Now, the vaccine's only approved for people 16 and older. Making it available to a younger crowd would be a big step in the fight against coronavirus. To help us go a little more in depth on this, we're joined now by Dr. James Conway from UW Health. Dr. Conway, thanks for joining us this afternoon. So Pfizer right now, the only one available for 16 and 17-year-olds. Why not the Moderna and the J&J vaccines? What's different?
Yeah, it's just the nature of putting together these clinical trials that Moderna started with the 18 and above, similar to Johnson & Johnson. Moderna has already fully enrolled their studies of the 12 to 17-year-olds, so we expect that we'll be seeing similar data to this Pfizer data in the coming weeks or months.
So I woke up to that news alert on my phone this morning from the New York Times saying Pfizer essentially 100% effective in this tween group, 12 to 15 years old. How encouraging is that we've got something that looks to be the silver bullet for that age group?
Yeah, it's really exciting. I mean, it's not surprising. We know that these are really strong vaccines that really give great immunologic protection, but this needed to be proven that these were going to be useful for our middle school and high school kids, and they turned out to be as good as we hoped that they would be, and I think this is really very encouraging news.
Cases in this younger crowd do seem to be less common, at least symptomatic cases. Why is it important to vaccinate them if they are at lower risk of getting the disease?
Yeah, this group and the young adults actually do fairly well with the disease in most circumstances. And so unfortunately, therefore, they don't even get tested that often. But we know that that group is really largely responsible in many communities for ongoing transmission and really do act as sort of drivers of ongoing circulation. You know, as we've been immunizing so broadly in the older individuals, those groups are actually less and less of the case cohorts that we're seeing. But this is the group that we really need to emphasize are going to be the ones that would allow circulation to continue, especially as these new mutants and variants start to be introduced.
Let's go back to that point you just made there. I've thought a couple times over the past year as we've seen the spikes come, as kids start to get their lives back to normal. Is it looking like kids are driving the spread more than other age groups?
Well, the young kids, not so much, but there is certainly evidence that these older kids that are basically young adults do have a role in continuing to transmit. And again, because they don't get very sick, and so oftentimes they don't get tested. And so they may be infected but not be aware of it with asymptomatic cases, or just have mild symptoms that don't really bother them enough to inconvenience themselves to go out of their way to get tested. But we know that that is a driver in many of the ongoing community outbreaks that we see.
Well, more good news as we want to get everybody vaccinated so we can have a level of herd immunity in our country. Dr. Conway, thank you so much for joining us this afternoon.